Our speaker this morning is Jeanie Larson. Jeanie is, what's your official title, Jeanie?
Donor recruitment representative.
Donor recruitment representative with Bloodworks Northwest. What she's going to do is talking about the need for blood donations, which have increased during the pandemic, and the number of donors has decreased for understandable reasons. So what she's going to do is share with us some information on how the blood we donate gets used, and then also give us some safe options to be a blood donor. So would you like me to bring up your presentation now, Jeanie?
That would be great, Bob. Thank you so much. First of all, I want to thank you for inviting me. I was really excited. We miss you guys. The staff, I mean, we miss going up to the Bainbridge Island Senior Center. That was one of our favorite places to go. It wasn't just the ice cream close by either. You guys are just really nice. But yeah, things have changed, like Bob has said. And we're kind of in a different world right now. And for those of you who aren't familiar with Bloodworks Northwest, I will just kind of give you a little bit of background information. One of the reasons I decided to join Bloodworks is because the blood that is donated stays local. We operate, we have contracts with about 90 hospitals, and I'll go into that a little bit. You can go to the next slide. I guess that's on the next slide, actually. Thank you. Yeah, we're the local blood provider to over 90 hospitals in the Pacific Northwest, and that includes Washington, Oregon, and even parts of Alaska. So any blood that is donated here actually stays here. And I think that's important, because the blood that you're donating today may be used for a friend, a neighbor, or even a family member in a week or two. We never know. I think that's one thing this whole pandemic has taught us, is we don't know what tomorrow is going to bring. So it's really important to donate with an organization where the blood is.
Okay, and Jeanie, you cut out. Okay, Jeanie, if you can hear me, you might need to. Okay, there you go. You froze up for a minute. So
yeah, okay.
I'll go back.
It's okay. I'm done with that one, I think.
Okay, I will move on
just
to
a
the next
little
slide.
Okay, just a little bit of trivia. If anyone can guess what percentage of the population is eligible to donate, and it's 40%. And if anybody would hazard a guess on what percentage of the population actually does donate on a regular basis, I saw some fingers up. And I thought, well, you're close. Yeah, 8 to 10%. That's all. So yeah, we're always trying to get first-time donors in and get people to donate on a regular basis, because we really need it. And this will kind of give you an overview of what the blood is used for. I think most of us think trauma, car accidents, things like that. Of course, that's a very big need for blood, but also cancer, mothers, transplant, organ transplant. And if you go to the next slide, I will give you a little more detail about that as well. A third of all, and I'm going to have to put my glasses on for this, a third of all blood is used for adults and children with cancer. A lot of times people on chemotherapy will require platelets or whole blood. And let me also point this out. When you donate, 1 unit of blood is separated into 3 parts, into red blood cells, platelets, and plasma. So 1 donation of blood can actually save 3 lives. So it's a pretty good deal. And accident victims, a car accident victim can use 50 units of blood or more. And this is a statistic that really surprised me the first time I heard this. We think we have the best healthcare in the world, and we do. But every 9 minutes in the United States, a mother dies because of bleeding complications during childbirth. That to me was shocking. Every 3 seconds, someone in this country requires a blood transfusion. And also for organ transplants, that is a big requirement. And I read something the other day. We got a message from a nurse practitioner at one of the clinics that deals with children with sickle cell anemia, and it just tugged at my heartstrings what she wrote. She works with these kids. Many of them require blood transfusions on a monthly basis just to survive. They need blood so they're not in excruciating pain, to deal with the complications from their illness, to try to have some type of a normal life. But donating blood is truly, truly a life-saving event. Okay, I'm ready for the next one. Yes, pandemic, a word we've all come to fear and hate, right? This is just, obviously, the COVID pandemic has impacted all businesses, impacted all of us. And in particular, with Bloodworks Northwest, it had an immediate impact. First of all, we could no longer do mobile drives. We can no longer use our blood mobiles. Closing down the mobile drives, it was just decimating to the amount of blood donations that we were able to get. The good thing was, in the beginning of the pandemic, our need for blood kind of went down because people were no longer having elective surgeries, people were putting off treatments. But as we continued throughout the months, they started increasing, and right now we need 1,000 units a day in this area to meet the blood need for our local hospitals, and we're meeting that. And the way we're meeting that, talk about challenges, we follow all the CDC and FDA guidelines. We keep this process as safe for our donors and for our staff as we possibly can. And just to let you know, the Department of Health has declared blood donation a safe, essential, life-saving event. So it was one of the events that was never really shut down, but just the way in which we collect the blood has had to change. We have to social distance. Everyone has to wear a mask, and we've been doing that since May. Appointment only. We used to get walk-ins, just put our sign out, and it was okay to have people just walk in to donate. We no longer do that, so we can keep track of social distancing and keep everyone safe. One of the biggest impacts, though, this year has been high schools. We typically do, most of the area high schools have blood drives. These are just wonderful places to get a lot of blood donations, as well as some of the clubs get to use this as a service project, organize the blood donations. Well, when the schools closed, that went away as well. And high schools actually make up 20 to 25% of our total blood donation. So we are scrambling to make that up at this point. And we've come up with some kind of unique ways. Bob kind of mentioned it a little bit, pop-up blood centers. Typically, in the old days, back in the old days, we would have mobile blood drives, and we would go out, set up shop, like at the Bainbridge Island Senior Center, be there for one day, get our donations, and would be gone. We'd be back in 2 months. You can donate safely every 56 days, just 8 weeks. Well, now with all of the regulations, we no longer do that, not only to keep our staff and donors safe, but also because of constraints on our resources. Like I said, we are a not-for-profit organization with limited resources. So now what we do, we look for large venues and go in and put our equipment and leave it there for a week or more. We've had pop-up centers at CenturyLink Field. The Seahawks have gotten really involved. There's a number of big venues that we've been able to use. We're actually having one tomorrow at Bethany Lutheran Church here on Bainbridge Island. We were there yesterday, and we're going to be there tomorrow as well. So we're trying to hit all of the areas that we used to go to and still do it safely. Does everybody know where Bethany Lutheran Church is? I will give you the address. It's 7968 Finch Road Northeast, but again, it's by appointment only. But we do come up here about every couple of months. So, okay, next slide, please. The opportunities that you have to be literally a lifesaver. And this is what is kind of cool. In all of the negativity, and we were talking about this before the meeting started, these are tough times. They're tough on people physically, they're tough on people emotionally, and it's kind of, I've talked to people that kind of feel like we're kind of in a negative fog, and it can be a bit depressing. What better way to kind of break through that and do something positive than to donate blood, to literally save lives? And like I said, it's safe, it's essential, and you can save 3 lives with 1 donation. There's a couple of other things that you can do. We now have what we call virtual drives, where we're not actually physically there. They're set up by clubs, churches, civic community groups. They'll get together and through social media or sending out an e-flyer or just calling people, get everybody organized, and we will give them a donor code, and then they can come in and donate either at a pop-up or one of our fixed site centers anytime. Usually it's within a 2-week period. Give them the donor code, and then the group kind of gets credit for that. So it's kind of a cumulative effect, and people can really feel a sense of community, which I think is kind of lacking right now. Sense of community and a sense of purpose. So that's one thing you can do. If you have a church or a club or any type of a group, I'm going to give you my contact information at the end. Please reach out to me, and we can probably get something going. Pop-up blood centers, I already discussed that, and sharing the information just on social media. If you're on Facebook, if you email people, just kind of sharing what we do and why it's important, because it is really important, and we need you. And so yeah, that's kind of what we can do in this, working our way through this. Next slide. And if you want more information, please go to our website, bloodworksnw.org, or you can call the 800 number. If you don't know if you're eligible to donate, or if you have any questions at all, call the 800 number. But if you go to our website, there's all kinds of information on there, everything from information about the latest on COVID to information about what we do. We don't just collect blood, we're also into research. We're internationally known as a very excellent research organization. We've been involved with convalescent plasma, if you're familiar with that. That's plasma from a person who has had COVID-19. We're working with that, and so we're into a lot of other things, but there's a lot of good information on our website that can answer some questions, give you some information, tell you why it's important, maybe give you some talking points even when you're talking with friends and family about why it's important to donate. And it is still a very safe thing to do. We take a lot of precautions. As I said, we follow all FDA and CDC guidelines, and I hope you can come out to one of our pop-up units, or shoot me an email, and we'll see what we can maybe get together and partner up with. Are there any questions?
Nice presentation. I appreciate it very much. And I came in just a few minutes late. You may have already covered this, but I'm interested in colloid testing and how you manage it prior to the giving of blood.
That's an excellent question. We get that question a lot. We don't do specific COVID testing, but we do. There's a screening process that all donors have to go through. We do temperature checks. and they have to answer questions. Of course, anyone that comes in with any symptoms, we're going to send them home. But it hasn't. The latest I heard is that it's not transmissible through the blood. But that's a very good question. And the whole thing, James, is it's a fluid situation. As we learn more, we change kind of what we're doing. As CDC changes their guidelines, we change their guidelines. The FDA recently changed a couple of guidelines where people were deferred for living in certain countries, and they've kind of relaxed that deferral at this time now. And there were a couple of other instances that the FDA has come in and said, okay, we don't need to defer people anymore for that. So we really kind of stay on top of things, but it is a very fluid situation.
Thank you very much, Jeanie. I appreciate it.
You're welcome. Thank you for the question.
I have a question, Richard Herzog. I have been looking forward to donating, but haven't been able to get into the city. So it's really good to know that you're here on Bainbridge, and I'll call in right now. Very nice job on your first remote. I used to be a speaker in the National Speakers Association, so keep up the good work.
Oh, thank you. That means a lot. I used to be in Toastmasters, and I miss that too.
I used to be in Toastmasters as well. Good, good.
Is there any charge either when donating blood or receiving blood? So are there any costs?
Well, no, when you donate, we only have volunteers that come in to donate. So there's no charge to donate blood. That's just people doing that out of the goodness of their heart. There is a charge if you receive blood. This is a good question. The people that take your blood are technicians. They're highly trained, and I'm proud of them. They're really good at what they do. You would not want to volunteer maybe doing this. So obviously these are highly trained professional technicians that obviously they have to get a salary, and the process. When I first started, I was able to go to our laboratory in Renton to see what the blood goes through after it's collected. It is amazing. It is a state-of-the-art laboratory, and all the testing that's done and all the processes that it goes through. It's amazing. And of course, there's a cost involved with that. So that's why, even though you're donating and you're not getting, paid to donate, if you do need blood, of course, the hospital is going to charge you for that. I hope that answers the question.
My name's Karen King, and I cannot give blood. I have leukemia, but I am a huge recipient. I have a slammed immune system, and I have to have gamma globulin infusions about once every 3 to 4 months. It's, and I can't tell you how grateful I am to people that donate. It's, it's been my lifesaver. So here I am. I'm the receiving, not giving. So, but grateful, very grateful. So
thank you so much for sharing that. I think sometimes people need to see a face and hear a story so they understand the impact. And I think the most loyal donors we have, Karen, are the ones that have a story like yours. Mm-hmm. That just like, I went through this, my family member went through this saved my child's life. We hear this a lot. And those are the people that really understand the need for blood. Mm-hmm. So you take care, and thank you so much for sharing that. Really appreciate it. Appreciate your support. And again, we miss you guys, and hopefully we'll be back up there when things get semi-normal.